Hi everyone, this is Dr. Maan here from Drbeen.com. I'm here with Dr. Arun Gulani of Gulani Vision, who's kindly giving us some of his time to talk about what he does in terms of eye surgery. Dr. Gulani, can you tell us a little bit about your story?
Surely. Thank you so much, Dr. Maan, for this invite. And absolutely. My story is pretty simple. It's follow your passions. That's throughout going to be my concept, backbone of how I practice and live. And I think it's all of us have a GPS in us, which we need to let it unfold despite our education. So my story is simple. I actually fell in love with ophthalmology. I'm biased. I think it's the most amazing profession that we can change people's lives in minutes. And it's very gratifying. Plus, it satisfies my other pursuit, which is technology, innovation as an inventor, and also as a fashion designer to constantly make the eye look as beautiful as I can. And I began in India, where obviously we had to top the university with a gold medal to get that single seat and become an ophthalmologist. Then wrote a book as a resident, one of the first books on the ocular tumors and color Doppler applications. I was invited to the US for fellowship. By then, I had fallen in love with the fact that I don't like anyone wearing glasses and contact lenses. And at that time, remember 1994, when I finished ophthalmology, that was a buccaneer science because it was considered you only operate on disease. So my passion has been since day one, since 3 decades, to make everybody see without glasses. And then on got the Career Achievement Award in the US, which other guys on the table were 60, 70 years old, and I was just 25 when I came here. And then it's just been a wonderful journey of executing passion in my own way, completely not sticking to the norms of business or the way people practice in a very personalized way. That's my short story.
Oh, wow. Okay. So I guess that makes me wonder, what is the magic that you have that, the secret sauce that helped you become so well recognized by the age of 25 in probably historically a very sort of older man or woman's profession, as is most of healthcare? What is it that makes people come and see you where other eye surgeons have failed?
I truly believe, as I said, it's just treat people like your own family. And that's an adage that I've always followed. Another secret I'll reveal to you on this interview, as I have, since many people want to write a biography and make movies on me, and I say, let me die first. This is too young for this. Is absolutely treat everybody like family, follow your own heart. And, that's why we're put on this earth. I mean, all of us have gifts. Why become like everybody and then compete with them? Isn't that silly in the world of business? So that's my, since a childhood dream, I fell in love with fashion the same way. So I've never looked at my work as a profession. It's a way to execute your passion. And what an amazing platform we have as doctors, right? Patients come to you, they trust you. All you have to do is deliver your best, and they already love you. So then you celebrate with them. So these are points that are being missed in medicine today, where it's become so cold and non-personal, if you may. So given that aspect, the secret I wanted to reveal to you is I've read no books in eye surgery or in the world of business. In fact, a lot of people fly to me. They give me, when they come, they want to give me books, worked on some of the world's most famous people. So they give me their authored books. And I respectfully tell them, but I keep them at home, but I never read. Because I want to go back in this life. I always want to see that I let my own GPS unfurl, unwind itself and lead me. And up till now, it's done great. So I don't think any doctor is doing anything wrong. The problem is most doctors have turned to this cookie cutter concept of medicine. Bring people in, advertise, bring people in, fill your room. That's why they call it a waiting room. I don't have a waiting room. It's a lobby. So in a waiting room, now you have 20, 30 people waiting. They're always, poor thing, delayed, reading your old magazines. Then you don't want to see them. After having advertised, you want your assistants to see them or push them around in rooms. You come in for a minute and look at your efficiency and leave the room to go back to surgery. So I think what they're missing is the concept of being an artist. We're surgeons. I mean, you're a plastic surgeon. Isn't it amazing that we get to do artistry? It's phenomenal. So how could you put that in a template? So that's my biggest thing I teach eye surgeons worldwide, how I approach each patient. So the concept for people who are listening here, Dr. Maan, is, as you know, Lasik, a very famous surgery, right? Eye surgery that is one of the most widely done surgeries in the entire world of medicine. In that surgery, most patients and doctors are still confused. They think of LASIK as one surgery. There are 20 varieties of LASIK that I do and teach. 20. There are over 40 vision corrective techniques and combinations of technologies, meaning there is literally no one you can bring to me who I cannot help without glasses and contacts to live their life. And safely, because you are designing the surgery. See how it's suddenly making sense? Every doctor, they know one or two techniques. Now they're running a Lasik mill, let's say. Everybody's coming in, they're getting a deal, come on a Saturday, pushing 30 people through, running away next day, letting someone else see the... What's the results? Over 70% of my practice is fixing complications of Lasik cataract surgery, for patients from all over the world. And I have yet to meet a doctor who did something wrong deliberately. It just happened because the mill concept and the same cookie cutter surgery to everybody. And patients are happy because they don't know what they missed. Imagine as a plastic surgeon, you can make the nose straight. Well, patient's happy. What if you could make it amazingly beautiful besides that, right? That's the level that's missing. How do I fix these complications? Again, simple. Because I do over 40 techniques and I'm involved in all the cutting edge technology, I look at your eye as a camera. There is no level of refractive error, meaning glasses prescription, that you can have that I cannot fix because you're designing it for that person, right? So I think that is the basic thing which I've been teaching for nearly 3 decades to eye surgeons, to empower them. If a patient comes to you with glasses, it's not like I'm doing a LASIK and here's the cost. It's about, here is the technique for you based on your safety, your anatomy, your optics, physiology, and long-term implications as you age. Now, because the surgery is designed to you, you have a near 100% rate of success. So my personal rate of retreatment or retouch, or what they call tune-ups, touch-ups, guarantees, is 0. Throughout the country, it ranges from anywhere from 2 to 18 to 20%, meaning doctors do surgery, then call the patient back next year, again, need to touch it up. My whole point is why? Do it right the first time. So I believe that is if you're asking for secret sauce. And then what happens is the more you do good work and you treat every patient like family, it's amazing. Patients fly their families to me. So I have been studied by numerous organizations and universities, including business universities, renowned universities in the world, who send their teams to find out how the hell does Dr. Gulani practice? It's very simple. By 5 o'clock, they're confused because I have no marketing team. I do not advertise at all. $0 in marketing. No schmoozing, no taking doctors out for lunch, dinner, asking them to send patients, no deals, no cuts, nothing. I just pull my whole focus and attention is my patients. So I greet each patient myself. I see them personally. I measure them personally. Perform, keep them, and my patients and my doctors keep testing me. I remember all my nearly 30,000 patients by name till today. If I pick a patient, I can tell you which country, what state, what was their story. So it's a genuine passion for them. And patients then fly their families, not only for complex things like LASIK complication, or you're not a candidate for LASIK or had a bad cataract surgery. Even for routine surgery, they insist that their families fly from Ireland, from Russia, from Hong Kong, wherever. So if you may, I think that could be the sauce. I don't think it's secret because I've been sharing it for years, but that could be it.
All right. Well, that actually has opened up a couple other questions in my mind. And one of those is, it sounds like you were pioneering, or one of the pioneers of personalized medicine, something that is an emerging concept, it seems, now amongst mainstream healthcare providers. But it sounds like you've been doing that for 30 years. And you talk about the fact that you don't market at all. So are you essentially saying that it's a word of mouth type of practice that you've set up there?
Absolutely. And like I said, doctor, this is subconscious, because remember, I told you I don't read business books. I don't go to any place which teaches business because I don't want anything to contaminate my inner heartfelt GPS of how people should be treated. So that's, if at all, as you call it, a secret sauce. The second important thing based on your question is, yes, what I've been doing for decades is now coming up finally, and they're giving it names. Again, these are marketing names, what you call personalized medicine, or what they call boutique medicine, or what they call chair time. It's like saying you had bonding time with your kids. Well, that's a very formal statement. You just get into bed with them, have a pillow fight and put them to sleep. So I like to teach that way, the natural way. What's natural for you? You come home, you pick up your kid and you enjoy that feeling. It's not about, is this bonding time today? So I try to separate that when I teach. I tell doctors, we are so privileged. First of all, you are so brilliant. Don't forget. And many doctors call me all the time because I have different levels of people who call or contact me. Doctors calling me because they're anxious. They're anxious, or they're jealous about their colleagues in town, anxious about their future, about what's happening with insurance, payments. I tell them very simple things. I say, listen, Who is more smarter and tougher than you? Among college grads of thousands, right? You are so smart, you went into med school. Remember your parents celebrated? That means it was something great, right? Achievement, right? Now, among the medical students who are already smart, you topped among them to be an eye surgeon. Isn't that true? Plus, that means you stayed up for 72 hours at a stretch. You could operate with eyes, your fingers on a 3 centimeter eyeball and stay awake and do an amazing job and look phenomenal. Who can be stronger than you? So why do you ever get scared? So my way of teaching is just be you. If you ever forget, look at where you came from. Haven't we all, Dr. Maan, stayed up at night? Correct? 48 hours?
Yes.
Read thousands of pages, memorized everything, correct? And you still look professional the next day. You can't complain, I didn't sleep last night, so mister, I'm looking horrible. No, you cannot. Plus, you have to do your intricate surgeries at midnight in trauma, right?
That's correct.
Who can match a doctor? That's my saying to doctors all the time. I mean, you're not a frontliner. No one can match you. Just deliver. And to a patient, you don't have to be great looking. You don't have to wear a suit. To every patient, their doctor is a rock star. All you have to do is at least maintain that pedestal. Don't do wrong things. That's it. As simple as that.
And, to your point, I'm going to use another phrase that we now have codified, but that it sounds like you sort of just did naturally, which is, it sounds like process over outcomes. You were never, it sounds like, focused on where you're going or how you're going to achieve business success. You were just being a doctor, talking to your patients, treating them like real people, and the results just came and spoke for themselves. And, you just focused on the work and the rest took care of itself, which I think is great. And I kind of followed your philosophy in that I didn't really Google or read too much about you before this interview. What I knew was that unlike most of our lectures and talks in Drbeen, where we focus on a medical topic, we were today going to be focusing on a how to do your practice type topic, which I think is also very interesting. And it's just, it's opening my mind right now, just hearing what you're saying, because, I think a lot of what you're saying resonates with my own beliefs and ideals, but I think it's very easy in the midst of residency, clinical practice, to lose sight of those things. So thank you, Dr. Gulani, for reminding us. And then you mentioned earlier about fashion and your interest in that. How did that interest develop, and how do you blend that with your surgical practice?
So it's my second passion, Dr. Maan, fashion, which is I love colors. I love things to be perfect, symmetric, elegant. And that's such a passion that there are two things where I lose track of time. One is when I'm with eyes, and second, when I'm with clothes. I lose track of time. I usually, and I teach all over the world right now. Of course, with COVID, you can't, but I literally spend a day incognito in the city anywhere, and I'll just go walking anywhere. I'll get lost in a store. So there are various stories of mine which are really fun, where I have things made midnight, delivered to the hotel in cahoots for my 4 a.m. talk in Japan or something. So it's fun. But I believe you must always weave your passion into your work. Why not? Why do you have a 5 o'clock separation? I ask people who are regimented. I'll do this, then I'll do this. I'm like, who's guaranteed you that? Do it every day. You're going to zip up and button up something every morning. Why don't you make it fun? Not expensive. Why don't you make it fun? So the line I started, my fashion line, because of the demand for men and women, mostly men, is Gulani Fashions. And my tagline is very important: for those who have arrived. So just like my eye surgery, I want to make sure the person is deserving. This is very important to me. And that deserving doesn't have to be like you got to be a billionaire. It's if you passed your 11th grade, let's say that's what your goal in life, or you couldn't do it, or if it's an autistic person who couldn't do something, or somebody who wants to be a doctor, whatever. You passed that goal, now you deserve the suit. Men, women, everything. So to me, the color palettes, I love colors. I can't understand why doctors wear black, blue, gray. In fact, most men, the suits are just 3 colors. If you go, that's a better blue though. If you go to any meeting, Dr. Maan, you'll see it. If you stand on top of thousands of doctors as we go to our academy meetings, right, where we teach, you'll just see a sea of black, blue, and gray, and white shirts. My question is, come on, the uniform days are over. That was school. Now show your true personality. How amazing would everybody look if they wore different colors, matched up and stuff. So how do I use it in ophthalmology? To me, I'm intolerant to doing anything on the eye that causes any blood, any scar, anything that makes it look bad. So I've also pioneered a surgery. As you know, Doc, in your oculoplastic field, patients have pterygium and pingecula, like that reddish growth on the white of the eye, and the eye looks bad. So for that, the only cure was cut it off and send the patient home. The recurrence rate is close to 39%, and patients are in pain. More important, no one realized these patients actually have a low self-esteem, because they're self-conscious, because people are looking at their eyes, right? And doctors would send them home. So I honed that surgery over 3 decades, and in fact, authored the first textbook released at the Academy in California. And just recently, last week, published a paper of 20 years follow-up, where I use a human placenta. It's transparent, with no stitches with glue. So I make the eye sparkling white. That's an extension of my fashion. Doing eye surgery, the way I do the surgery, no stitches, I want everything perfect, is an extension. So to me, it's really how you weave your passion every day. Don't wait for 5 o'clock, just do it.
Oh, it's fascinating. I've actually done some basic science, which is my second passion. And I guess it's still academic, but I do basic science, and I've done some basic science research on human amniotic chorionic membrane. So, I can understand what you're saying there. So that's fascinating. Okay. So with all of what you've done, with people pursuing you to write a book, have a movie, all these sorts of things, most people of your ilk would be practicing in, Rodeo Drive or Fifth Avenue in New York, and you're still in Jacksonville, Florida. I say still, but I don't know how long you've actually even been there. You could elaborate. Why is that? Why have you decided to stay there?
So destiny to begin with. I came to Florida from New York, actually, invited to be the head of department to start the Lasik department for University of Florida here, Jacksonville. So that's what brought me here in 2001, nearly 2 decades ago. And again, being the way I am, never following the normal path, not joining, starting in New York or joining somebody there. I just took the challenge. It was a very, I may say, not a great department. Department needed a lot of work to even come up to normal, forget reaching the standards I wanted. So I took it as a challenge, and I came in to help out and did a lot of great work. In fact, I used to come in literally and work very hard, did one of the world's first artificial corneal transplant, had people flying in. So that's what brought me to Jacksonville. When I started my practice, because I couldn't deal with the way people were wanting me to do things, which is see 80 patients a day, this is what we do, that makes a lot of money. I'm like, this is nonsense. I want each patient one at a time. I'm an artist. I'll do it this way. So I had to put my money where my mouth was. Now, by this time, my kids were in school, remember? So both kids in school, and I'm in Jacksonville. And I thought, you know what? Yes, I had a lot of, a very, very, very firm feeling that I should be on Rodeo Drive, Fifth Avenue, New York, or somewhere, because it matches not only my profile, but my desire for fashion too. And then I thought, you know what? God has been really kind to me. He's given me so much. Let me just make my life an example of why every youngster should look at me and go, if he could do it in Jacksonville, I can. That's what made me stay. So my first year, I was still in doubts, but every time the patients flew to me, I would literally ask them, what is difficult? And they'd say, yes, Doc, is very difficult. We had to come to 2 airports. But they would say, Doc, it was worth it. So that was my feedback, Zishan. Until today, I always use my patients' feedback as my planning forward. So I used to literally ask them, imagine a doctor who's just started with 0 patients. And remember what I said to you, no advertising, no schmoozing, no deals, no nonsense that you have to do to start your practice. That itself is the whole story of what happened there. But the fact that your patients are guiding you is the most amazing way to expand and grow.
So you're not into social media either?
Oh, yes, big time. The fun thing here is, again, Zishan, like I mentioned to you, a lot of universities and marketing people have flown to us trying to find out how we've done it so successfully. And again, my answer baffles them. I do nothing. If you go to my Facebook, every day my patients from somewhere in the world is writing, and not 1 or 2 lines, paragraphs with photos, with pictures all over. So it's become an abnormal norm that I've created for the industry, where my patients are writing about my work everywhere from all over, and no incentive from me. I'm not writing it. No marketing from our side. The other important thing this has done, Dr. Maan, is I recently gave an interview in the Academy Ophthalmology Times where I said, show me the patients. Remember Jerry Maguire, show me the money? So that was 30 years ago. I said that before him, so to make sure they credit. Show me the patients mean. People are constantly writing white papers and showing graphs, right? That's the only way doctors know to learn. My thing is that's wrong. In the graph, how many people are really blinded? You can't see. It's just a graph of failure, success, percentages. I'm showing you real patients who have paid for their surgery, who have no incentive from me, and they're writing paragraphs on Facebook. That is to me the highest accountability of a surgeon. So in fact, I say that first funnily, but I actually make it serious is the only level of accountability today of a successful surgeon is his patient taking a selfie with their doctor and posting on their own social media. I'm saying this very seriously. Now, imagine this, doctor. Many people have told me this, Dr. Gulani, aren't you afraid these patients are sitting up at night? They could just type anything. I'm like, it's okay. That's my confidence in them. Doctor, what about 5 years from now? If something goes wrong, I'm okay. That's how confident I am about my work. And that's how honest I am. If someone wants to write something bad, it's okay. I just want to be very clear that it's unpoliced. So to social media, the way I've been doing it, in fact, even that I have created a legacy today of, I want every doctor not to post themselves. That's advertising, right? Hey, my patient's doing great. Here's some lipstick, here's some writing stuff, and here's a Starbucks card. Wrong. Let the patient do it. And that again becomes its own snowball, where the patients are writing among themselves. And if you go to my Facebook, they're actually writing medical language. That's how knowledgeable they are by the time they come to me. Because over 70% of my patients are complications of LASIK or cataract or second opinions, etc. And by the time they come to me, obviously they're very smart, very educated, and they want to know what's what. But if those patients, after a 4-minute surgery, want to type their whole experience, it tells you that's what humans are all about.
No, that makes sense. So essentially, you're not using social media in the way that nowadays doctors are being taught to use to set up their practice. It's just a vehicle for word of mouth. It's just a more, it's just a more rapid rate of spread. The R0 for social media word of mouth is higher. That makes sense. So do you ever worry that you'll be a victim of your own success? Because as someone training in plastic surgery, what I can tell you is that our entire specialty is based on solving problems for other surgical specialties, innovation. Our specialty was created by a group of surgeons only 60, 70 years ago at the end of World War II. So it's not really a real specialty in that sense. And it's just a set of principles that develops new techniques. And eventually those techniques become disseminated to others. And so either we have to continue to innovate or we'll die. And it sounds like you're teaching your principles of practice to everyone. And if everyone became a Gulani type surgeon, who would be coming to see you?
Again, this is a very good question. Actually, very, very, mindful question here. I don't think about it. Simple answer. I'm so having fun. I'm not thinking about that. I just know that what I'm doing is changing lives. I'm genuinely, selflessly teaching eye surgeons all over the world, eye surgeons, optometrists, every level of eye people. Just today, there are 9 webinars I'll be doing. My point, get so involved and have fun. Don't forget that part. Have fun. Cannot do it as, oh my God, this is work. Then don't do it. You didn't go to med school and go for 30 years of training to come out looking so depressed and worrying about the beeper on you and what the hell am I doing? Think about it. When I tell these things to doctors on world stages, they get shocked, but they realize it's such a fact. Why are you depressed? I ask them. Aren't you amazed at what you can do? So I don't think about those things. I would love for every eye doctor to do what I'm doing. That's why I'm teaching. That's why I teach at all levels, all over, including the whiteboard concept that we'll discuss later. But I have 2 concepts here. I'm teaching not only doctors, doctor. I'm teaching patients too. Don't go in for a LASIK without asking the doctor about the other 20 techniques. Don't fall for the ads of come in on a Saturday or here's the deal. No, these are your eyes. I'm the one fixing complications, guys. I know how depressing it's for a patient when they lose their vision. Now, all of them can be corrected, most of them, but why fall into it? So education is at the patient level and doctor level. I'm also coming up right now with modules of how others can do things working with the industry, meaning literally, doctor, it's like if you were operating, a picture-in-picture will come up. This is what Dr. Gulani would do. So you could be sitting in a far-off country, but you could just follow my steps. At least 80% you'll get it right. That's phenomenal. So no, I don't worry about those things. I would love for everybody to do what I do, and I will still do it.
That's great. That sounds like a great answer. And I think that's also a conclusion that I've internally come to. We should all just be doing the best for our patients. And in that way, if what you can deliver is the best, your patients will be happy, everyone will be happy. So that's great. And then to that point you were just making about these various techniques and personalizing it, as a doctor in general and as a surgeon, and specifically one who operates through microscopes, what I can tell you is that my colleagues have all avoided ever getting any sort of corrective surgery for their eyes. I wear contact lenses myself. And the reason being is that there is a percent risk of either vision loss or developing, even at the milder end of the spectrum, what for many people would be almost unnoticeable halos. But for someone who operates in a dark room with lights on the patient and through a microscope would be disastrous. And so we avoid it. And I'd ask you, what do you say to people like me? Can you offer us something that would help mitigate that risk? You know, obviously, if anything, we think PRK is a better option than LASIK, but it'd be great to get your thoughts on what you think some surgeons should consider.
Lovely questions, John. I get that a lot because I do have perhaps the largest clientele of patients being doctors and surgeons. Yes. I will answer your question at all levels, and it's amazing that you bring this up at all levels. First, let's go backwards. You talked about LASIK and PRK, correct? Mm-hmm. So how many options did you talk about, Zishan?
2.
Here's how I talk about this. You came to a restaurant and all you asked was, do you have a burger or a hot dog? What's the mistake you're making? That cook or that chain restaurant guy loves this because that's all they know. They're like, oh, this guy's perfect. He's our kind of guy, burger, hot dog. So what you're missing is the point which I said, there are 20 LASIK techniques. I'm calling it LASIK for ease of discussion. I've called it different levels from pioneering it. There are 40 vision corrective techniques. You go to the restaurant and go, it's lunchtime, I'm hungry, make me something mind-blowing. Now the chef gets to work. 500 ingredients, 1,000 recipes. Make sure you're not a diabetic. Make sure it's your palate. Make sure you can handle spices, not handle spices. Pick the correct ingredients for you. Pick the correct nourishment levels for you. And then here's the most important part. Don't give you a choice. That's the confidence of the chef. Mr. Maan, I'm going to do this for you. Among all these things, here are my 5 reasons. No choice. This is my plan for you. I'll be clear about this. Now, because, doctor, that was designed for you, the chance of success is close to 100%. Chance of downside is close to 0%. You see my point again? You are planning for success. The reason most people have these complications you described, halos, inadequate vision, is because they had a cookie cutter surgery not fully designed to them. So it ends up correcting, let's say, 80% of your issues. Why are most patients happy? Because they don't realize that the other 20% was left on the table. Are you with me? This is the biggest thing I teach eye surgeons worldwide is my CLEAR system, KLEAR, Keratolenticular Extended Armamentarium of Refractive Surgery, meaning 40 vision corrective techniques. So when you go to a doctor, don't ask about LASIK, PRK, or whatever. Ask about, these are the glasses I wear, doc. I'm a plastic surgeon. I work on a microscope in a dark room. I'm a young guy with young kids. I have my life in front of me. Plan for my presbyopia too, because I'm heading towards my 40s. What would I do? And the doctor should get up and give you one option plan, not choose among these different things. That's wrong. So that's my first part to your answer. Second part, a very important statement. Majority of these complications I can fix. Like I said, over 70% of my practice is patients with side effects and complications flying in, right? LASIK, cataract, and these all can be fixed, all these patients. But you don't want to get there. You want to prevent it first. So my answer to all that is, all of you are candidates for surgery. That surgery has to be designed for you. And yes, the technique that I've been doing and teaching now for over 2 decades is laser plastique, a non-cutting, no blade, no flap, no cut technique of laser vision surgery, especially for doctors, because also we tend to go drier because we focus on a microscope, so you're not blinking as much, right? So when you now look at all these aspects, suddenly your mind will open up and you'll go, that's right. Why was I thinking of burger and hot dog all the time? I need a master chef. And let me put it in your profession perspective, doctor. You know what? Let's say we talk about your profession for a minute. I'm going to turn the tables on you for the same question. You have a crooked nose and you're so scared to undergo surgery because you heard that you can have a permanent dent on your nose. That's crazy. You just want an amazing doctor who knows what to do for your nose and what level of cartilage rebuilding he has to do. And I want to make sure the doctor makes me prettier than before the broken nose. So you see, it's such a simple concept, but the most confused system, patient level and surgeon level. Surgeons only talk about 2 things and they come back from the academy, they have a 3rd thing to talk about, correct? Or sell. Wrong. Look at the patient, plan it, go back to your kitchen, your surgical room, pick up the right surgery, right ingredients, perform. In many cases also beyond 2020. So that's important too.
Oh yeah, beyond 2020. Tell me a little bit more about that. What does that mean?
So it's funny. This came from my heart again. I told you I don't read books.
Yeah.
When the year 2020 started, a lot of people were doing these 2020, people, not even doctors. Remember, they're advertising this 2020 vision. Something in my heart told me beyond 2020. And there are many reasons for this. Number one, my own vision. I'm blessed. I was born with 2010 vision, which is 2 lines better. Therefore, I'm never satisfied with 2020 in a patient. I always aim for more than that. I don't believe 2020 is perfect. You can aim for that based on your potential as a patient. Two, it means beyond the year 2020, because I'm not ending my innovations in 2020. Hopefully we are alive and we're doing more stuff beyond 2020.
Yeah.
Three is it has a psychological implication that is not just vision we are talking, because 2020 we always talk about hindsight, correct? Mm-hmm. So those are 3 reasons I picked my own hashtag Gulani beyond 2020. Now the fourth reason has become whether it was a prophecy I knew that 2020 was going to do this to us, that we're looking beyond 2020. So my true desire is I want every patient to see beyond 2020, all of us to think beyond the present times and really build it, design the future rather than getting worried about it.
So, I mean, you've taken a lot of risks. Your path is very different than typical. And then as a young surgeon myself, and there are so many other young healthcare practitioners who, whether they be a nurse practitioner, a PA, a doctor, a surgeon, whatever, who are starting their careers now and considering their various options. You chose a pretty high risk pathway. Would you advise that for most people? I mean, were you scared when you set out on this pathway?
No, certainly not scared. And I would insist, not suggest, I would insist every doctor, nurse, in fact, any professional to go all the way. I mean, come on. Do you come out of school thinking I'm going to do only this much? This way I'll sleep better at night. There's no such thing. Think about it, Zishan, for a moment. Let's say you're in a job somewhere, okay? And you're feeling comfortable about it because it's a 9 to 5, you don't have administration hassles, you just drive to the hospital, you come back. You can be fired anytime, right or wrong?
No, that's true, yeah.
1, 2. Let's say you join a big group because you want comfort, careful, you're not confident you'll have enough patients, so you join a big group and you get in there. Now what? You're being used day and night, they're putting twice the number of patients on your plate, there's no partnership, there's a carrot hanging. Do you sleep well at night? No. 3. Whatever you do, let's say you work for corporate, you have a steady paycheck coming. Corporate tanks, guess where you go? It's over. So my answer always is, this later on I got to know the saying, I used to say this always is, be more confident on your own strength than on the pillar you're resting on, correct? Because that can break anytime and you go down with it. So my path, if you may call it high risk, I just say that is the only way I knew how to do it because I didn't follow anyone. I could be wrong. Absolutely, I could have been wrong because everybody else was following a pathway, right? Partnerships, join hospital, don't do this, don't do patients who are high risk, don't tackle patients who are very demanding, don't do Lasik beyond 2020, don't need to push for all this. And I'm like, that's crazy. Patient is trusting you. Why won't you deliver the highest level you can, right? Second, you are doing it your way as long as you are ethical, high integrity, don't fool around, don't cheat any patient, don't do any kind of deals and stuff. But as long as you're following your ethical rules, I would say go full blast because then you are doing it your way. In my institute, because fashion is important, I've designed my institute myself, the colors, the architecture, same for my home where I'm sitting right now. So to me, everything reflects what I like. So if you are my friend or family and you come to meet me, you're seeing a consistency around you. That's very important as a surgeon, which you know, right? How would you like an eye surgeon who himself is wearing glasses and then walks around with a little post-it writing things and calls himself high tech? Yeah. It cannot be true. So consistency is vital. And again, none of this has to be expensive, but you must have your shoes polished. Men, women, whatever, I'm always talking generally, because that shows that you care. And I say this too, we are going a little extended in this talk, but when you have an important guest coming home, what do? You clean up. You dress up, you lay everything in the right place. But if you have someone you're not interested in coming, what do? You show up, you come in pajamas, you care a damn for the place, right? That's right. To me, that's wrong. In my institute, the first requisite for my staff is treat every patient like family. Nobody waits. I am responsible for anything that goes wrong. So it's simple for my staff. And I pick up a piece of paper I see lying on the floor anywhere. It then gives a subtle message to my staff that our doctor will not tolerate anything that is bad. But he will do it. He doesn't think low of that. So these are subtle messages. So my message to every professional, not only doctors, is go full steam. You're not guaranteed another life.
That's amazing. And that last comment you made reminded me of this book that I read recently called Extreme Ownership. I don't know if you've ever read it.
I don't read books.
Oh, of course, I forgot. Yeah, it's a description. I'll just tell you by Navy SEALs about this concept of the person who's in charge is responsible for everything, and that level of ownership sets an example for everyone else in your team. And so that sounds like that's great advice, and sounds like through your life experiences, that's another lesson for us, is that through these life experiences you learn all these things that you read in books, and perhaps the lesson is better taught in that way.
More important, doctor, is exactly what you said in the book may make sense, but I say this a lot to doctors. Take credit for what you do. Doctors miss that. Post-op, after surgery, they don't want to see patients. They have assistants seeing patients, nurse, whatever. I'm like, why? I say, look at your own Mona Lisa. Please let them hug you and thank you because you did an amazing job. By the same token, be responsible. If you made a mistake, you and your chest should be out. Take the bullet. So I, in fact, teach it that way in my simplistic way of teaching, right? Be you. If you see on my website, on my Facebook, Dr. Maan, it's got crowds of patients with me, hugging every Friday before they fly out. Crowds. And I see one patient at a time. Remember, 1 hour, I personally with every patient, I check everything. I measure everything. I know their name for life. So you're making yourself responsible. So same credit. When they're sitting there, they want to hug you. It's all fun for me. Do it. So that's more important, I would say, is take credit with responsibility.
Perfect. So, Dr. Gulani, you've given us so much of your time, and, I can appreciate that, you have 9 webinars today still happening. You're a very busy man. We really appreciate you taking this time to talk with us here on Drbeen. And I just wanted to finish with one final question, which is that vision, which many of us now see in hindsight of what, the way healthcare has gone over the last 20, 30 years was so accurate. And it begs the question of, what do you see beyond 2020 in the future of, 1, healthcare, and 2, specifically, perhaps ophthalmology, but for those of us outside of ophthalmology, healthcare in general as well?
Sure. So in ophthalmology, as I said, Dr. Maan, my desire is every eye doctor do what I'm doing. So I'm teaching, encouraging, pushing. I do want everybody to aim for beyond 2010 vision. Beyond that, it's Eagles 20/7. I want all the technologies that I'm involved in internationally, worldwide, when lenses in the eye after cataract. Most of my patients after cataract don't wear glasses for distance or near, or laser vision patients. Most of mine are beyond 20/20 vision. So I want those lenses that I've worked on or been involved, had the privilege to be involved abroad, those lenses that actually change your vision in real time. You charge it on your pillow. So imagine we'll be bionic in a couple of years. You'll go to like a gas station place, put your arm in, and everything charges up. So your vision will be perfect. Now, if you're looking at a mountain, you can maybe press a chip somewhere in your hand and it focuses on the mountain. You're starting to read, it focuses on X-ray. I think that's the future of vision. 2, of course, pathologies will be taken care of, retinal, irreversible presently. I believe all these errors, nearsighted, farsighted, astigmatism, reading glasses, which presently we have captured, cataract, keratoconus, RK, scars, it'll go to the next level where everybody will provide these things. As far as healthcare is concerned, I personally believe humans cannot change. We're all the same. Everybody, and now's the best time to realize how social everybody's missing it with the COVID scenario, right? So humans are social. I believe the doctor-patient relation has to come back. I give my cell phone to every patient. These are over nearly 30,000. Can you imagine? I have yet to have a patient, even one, who called me without first apologizing. What does that tell you? That the patient already respects your time. How difficult is it for me to respond to that patient? The answer is no. You just pick it up and go, Doc, I'm Mary. 6 years ago, I had surgery. My daughter. I'm like, shut up, Mary. Of course I remember you. How the hell is John doing? Wow, blown away. But that's your true love for them. So doctors make so many barriers. Oh, they call the service, then they call my assistant, then I get a call. By the time you're already in stress, correct? You can't sleep. Even though you haven't spoken, you're already in stress. You're waiting for Monday to speak to that patient. Pick up the phone, speak to them, finish it up. So I think being personal, which is a mandatory requirement for doctors, patients, be focused. Don't worry. Don't be anxious or jealous of people. Just keep going. And third important thing, future, I believe the teaching part, which I have lots to do. Not only my eye doctors and eye surgeons, but patients, students in medical residence, which you guys at Drbeen are doing an amazing job, teaching residents, inspiring them. not just teaching them. I mean, they need to understand why they're doing this, reading thousands of pages. They need to understand why are they staying up at night. We have to explain to them why. They need to be inspired. They're all asking me questions. I have a lot of patients who come from these Googles and these top companies and Microsoft. And, when the doctors who are visiting with me, they go, well, doc, they're making six-figure salary and they're just 20 years old. We'll be 40 by the time we start. I'm like, but understand why. You chose the path. You chose the path. So we have to explain Dr. Zishan more than medicine when we teach on the whiteboard. We have to explain, inspire that what you guys are now learning. First of all, you are perennially employable. You can go to the backwoods of the Amazon and you'll still be respected and have a job because there's a human being there, right? So what an amazing profession to be in. Besides that, you can do other fun stuff. You can do your fashion. You can do, like in your case, basic science or research. You can go dancing, do whatever. But first, be a doctor.
All right. Thank you so much, Dr. Gulani. That's very inspiring. And thank you again for your time. Is there anything else that you wanted to add? I mean, that was a fantastic finish anyway. Thank you so much. It was great talking with you, sir.
My pleasure again.
Take care. Bye.